Now for much more, we're joined by Dr. Bharat Pankania, Senior Clinical Lecturer at the University of Exeter. Always good to have you with us, but usually the topics are not so positive. But here, how dangerous is the Omicron variant? What do we know at this point? It's new to the world, so what can you tell us?
So what we do know now is it's definitely much more infectious. And even if it is mild disease causing, because it is much more infectious, it will generate more cases. And if we take a percentage of those large number of cases, then unfortunately, it will result in many people being admitted to hospital and some dying, even if it is, in most cases, a mild disease causing thing.
Now, looking at the United Kingdom, so in focus again, and just added to this short red list of travel ban in Israel, is the country struggling there under Omicron worse than others, or is it simply doing more testing and producing more, or I should say the most data on the new variant?
So United Kingdom is in the rising wave of cases. So at the moment, the case numbers are shooting up. Of course, there is always a lag period between case numbers going up and hospital admissions. So people will argue, but we haven't got the hospital admissions. And my counter answer to that is you've got to give it 2 to 3 weeks to see if people are ending up ill and in hospital, and then another few weeks more to see if people are getting more ill, and then another few more weeks to see if it is resulting in more deaths. So there is always a lag period, and whilst we are in that lag period, we've got to be precautionary and careful.
And along those lines, precautionary measures, many countries closing borders again, ramping up vaccines, the booster shots we just heard Prime Minister Johnson speaking about. Is that the way forward, or is there even the possibility for total lockdowns again in the UK?
So look, this is a failure of our government and maybe others to tackle infection control properly. To tackle infection control, it is never a one-item intervention, i.e. boosters. What we should have been doing, what we should do is boosters, yes, but we also got to wear masks, higher specification masks, wear it properly, reduce your gatherings in parties, work from home. So all those measures are equally important, including immunization in schools and reducing the start of infections there, which then go on to older age groups. So it's a multifaceted thing. We've got to address each item rather than the one singular item, which is boosters, boosters, boosters.
Now, there's a lot of talk about the vaccines and booster shots in the countries that have supplies. Do you think there will be increased focus now on the many countries, specifically where these variants may be emerging, that basically don't have vaccines available yet? Will there be more of a focus on developing countries?
We have to be truthful, because until everyone is well, no one is well. And I have always said that if we had implemented the World Health Organization plan, which was to simultaneously start immunizing the world, then what would happen is Africa would be having a higher uptake. We would be slightly higher, but not so high compared to Africa. And if we just suppress infections slowly, carefully, across the world, then you get fewer variants arising. And we really must go back to immunizing Africa as fast as possible. Otherwise, we're out of sync. Europe and Africa out of sync. And when they're out of sync, we will generate variants or they will generate variants. We don't want to do that.
Dr. Bharat Pankania, as always, thank you for your insight.
Thank you.